Hey guys, Dr. Day here with Mountain Movement Center. We're going to go over tightness that comes to the upper neck from sitting at the desk all day. Now I got my basketball here, well, just as a prop. What I want you to visualize is the basketball is your head. My hand is your first cervical vertebra. Now what's very interesting about your first cervical vertebra, C1, is also called the atlas. Just like Atlas holding the globe. Maybe you guys have seen that statue. Here, my hand is C1 and the globe is your skull. Now here's the problem. It's supposed to sit directly on top, but in modern day, our head goes forward. And so we crank our head into extension and it creates a swiveling compression on the skull closer to the atlas. So you get like this, your muscles get shortened here, the suboccipital muscles, the nerves that exit there, and the joint starts to get stuck in that position. So you see people walking around all day like this. They don't know it, but their joint and their muscles are stuck in that position. The good news is our brains can be retrained and the nerve connections in the joints and the muscle, the proprioceptors, the nerve endings, can be retrained. So we're going to go over how to open that area back up. Okay? So this is called the chin tuck. And what's interesting about the chin tuck is you want to elongate as if there was a string on the crown of your head. A lot of people do the chin tuck by just pressing back. We don't want that. We want to elongate, lifting the head high and up this way. Feel that string pulling, and then tuck the chin. So that's really useful because you're like this 90% of the day these days with phones and computers. And so we're elongating, and then ever so slightly we can apply a little bit of pressure on our chin. And that's going to tuck the globe, the skull even higher, okay? Because it all rotates this way. So that's why I wanted to have the basketball here as a visual. So we're elongating, and then we're going to do 10 deep breaths here. And here's a little thing I like to add. I'll turn, tuck, and press, and then just with my thumb, I hook. It's not pulling. A lot of people pull on their head. I hook under this bony protuberance here, and I pull with a tuck, and that stretches these outside suboccipital muscles, and then again on the other side. So we're going to do 10, 9, 8, and you want to breathe from your belly. And then another video we're going to go over, but you can just bring your thumbs back at the same time and engage the muscles between your middle and lower scapula or shoulder blade. So this area is incredibly useful too with soft tissue work. If we do soft tissue work on the suboccipitals, lengthening the tissue and doing pressure point hold in and around and working the fascia that comes up into the skull, it can be tremendous results for headaches, just head pressure, brain fog, all these types of symptoms, eye pain, jaw pain. And then the chiropractic adjustment is simply inducing motion into that joint. And in the day method, we do everything from just holding at the joint to using a little tool that will kind of induce that motion, to doing motion like this, and it induces motion, it creates motion at the joint of your occipital joint and your C1. And we might hear a noise, and all that is a gas vacuum created and an audible cavitation. It's not your bone, it's not your tendon, anything like that. But that's grade 4 in our day method approach. Some people who aren't very comfortable with that, we just work on mobilizing, working the muscle, and then retraining the muscles of the neck to remember that neural signal, because your brain can forget it. As you do this all day, this is your new normal. So you lose that joint mobility, and the muscles gain tightness, we call hypertonicity, excess nerve signal, because they're like, this is what we are now. This is what we have to do. We have to fire all the time. And then they even get trigger points or knots. And when we go in there and palpate, we can find and map out those trigger points and release them. Now, granted, we're not isolated beings, so we also take a look at the jaw, head position, and the alignment of the chest and shoulders as well. because you're never not going to just be tight right here. So I hope that helps. Work on that chin tuck stretch. If you have any questions, drop me a message in the comments below. And if you want to know more about our center, go to the liner notes. All right, guys, thanks again.